Life is complex.
So is our mental health. It cannot be understood by diagnosis alone.
Our philosophy is treat the person, not the mental illness.
Hello, everyone, and welcome to another episode of Humanizing Mental Health. I'm Trent Nakers.
And I'm Jeremy Alcorn. We have a guest today. We're very happy to have a friend and colleague, Dr. Grewal. Likes to be known by his first name, Prav. In fact, I would say your full first name, but I can't pronounce it.
I had to go by it anyway, so it's okay.
So given a little context, Prav and I know each other because he recruited me to come work at the mental health department with Canadian Forces based in Suffield, where recently, I guess it had been about a year ago, he was the base surgeon. Both of us have a very strong interest in mental health and in trauma and in trauma healing. Prav right now is studying to be a psychiatrist, and we'd really like to welcome to the show, Prav, and find out, because I think this is part of what we're most fascinated about, is the type of mental health and trauma process that you work with.
Yeah. So, bottom line up front, I'm interested in psychedelic-assisted psychotherapy. And, this has been a long path for me to come here. So, initially when I wanted to enter medical school, I was always interested in the mind. And, as a part of entering medical school, especially in BC, a component of that is the volunteer work that you do, right? So I was volunteering at several organizations, one of them, which was the crisis hotline in Vancouver. So, I grew up in a pretty healthy home environment. I had really wonderful parents. So, I wasn't really exposed to sort of that dark side of the dark underbelly of society. And until I got to the crisis center, and I was talking to people day in and day out that were suffering with severe mental illness. And, another place that I worked as well, and that sort of led me to this journey, is I used to volunteer for an organization that helped tutor Afghani refugee children. And one day when I was volunteering there, I casually had mentioned to one of the directors about the documentary Soul of the Vine by Gabor Mate, where, they're going to the Peruvian jungle and giving them ayahuasca, and, they were having terrific recovery rates for heroin addiction, something around the order of 60%. You'd be lucky if you get 5% in our current standard of care. Wow. And so, I casually had mentioned that to her, and the following week she came back, and, she was more on the hippie sort of free-spirited side, and she came back the next week and said, "Hey, I know 2 shamans that perform ayahuasca ceremonies. Do you want to go?" And, at that time, I really didn't have, like I said, I grew up in a pretty privileged household. I just got into medical school. I was on top of the world. I really didn't have, many issues to sort of deal with, any trauma. And, so we go there and we participate in the ceremony. And, I just had extremely profound experience with that medicine. And, the experience felt more real than, this reality that we're in. And that's a pretty common, I later found out it's a pretty common feeling that individuals experience while they're taking psychedelics. So anyways, like I said, I didn't feel like I had any issues to deal with, but even with that experience, I realized that, I actually had set up a lot of rigid structures. I had a very rigid personality at that time. And, through that experience, I was able to reflect on why that was the case in real time as I was going through that. They came to the understanding that, I was the oldest child, immigrant family, going to medical school for the first time. There was, significant pressure to perform on me. And I had to set up rigid structures for myself to be able to perform, which I did. And then at that point, I realized that if I had continued with this sort of rigid personality structure, that it's going to cause me problems later in my life. That's sort of the realization I had. And so at that point, it allowed me to sort of realize those things and then also change it at the same time. And afterwards, people that are close to me, friends of 10, 15 years, told me that my personality changed, right? It was that profound experience.
Yeah,
and so
yeah.
it was really at that point where I'm like, oh, okay, there's something to this, right?
Sure.
And this can be a pretty useful tool.
Yeah. And, I really appreciate you bringing that up, because I think for a lot of us, when we hear a lot about psychedelics or mental health, that people feel like they need to be in visible distress, or really struggling in order to utilize these medicines or these approaches. But I love the fact that you highlighted the fact that I came from a healthy home, but it's about really kind of digging underneath there. And it's like, how am I functioning? And is that really healthy for me? Or will that cause me distress potentially down the road?
Yeah, as you point out, you use the word, I think, rigid structures. And as you were saying that, and as you're talking about insight that you built, and that insight directly manifesting into changes,
Mm-hmm.
I couldn't help but sit here and think, Trent, in the last 5 years, how many times have you had someone just blow their mind in a therapy appointment, and then a couple weeks later, they're still in the same stuck pattern?
Oh, all the time. Yeah. And I mean, like, it happens. And it's almost like your Sisyphus. They roll the rock up the hill, and then they get it up there. They have the insight, but then the next day, the rock is at the bottom. And it's like, okay, like, what's that? But it sounds like for you, Prav, like, what it was is that you were able to roll the rock up the hill, and you put the chalks on the boulder so that it didn't roll all the way back down. Am I wrong?
That's exactly right. And I would expand that further. So, the patient that you're talking about had a cognitive insight. They understood that pattern, but they didn't have the emotional insight to overcome why that pattern existed in the first place. And that's what the psychedelics do. They facilitate both the cognitive insight, the recognition of your patterns, and then also the emotional insight of why those patterns formed in the first place. And that's why the therapy can be quite profound. And you'll see it if you look at the studies. People with depression scores in the severe category within 3 days, 7 days, or drop by half. Because you get those insights right away, and then they tend to stick because you both have the cognitive and the emotional insight.
Right. In fact, if you were to look at any kind of big T trauma event, the most significant issue in the big T trauma event is the emotional impact that it had. It has this deep emotional impact, and that emotional impact is the thing that is remembered above anything else.
Yeah.
And so to be able to say you need to integrate the emotional process totally makes sense to me. The power of that, I would say often part of people's problem is that the cognitive aspect of themselves and the internal emotional processes are actually disconnected. They're not actually linked.
Yeah. And then, in those sort of situations, the individual's fragmented. They're holding essentially two dissonant beliefs about themselves or reality, right? And psychedelics are really good at helping you to integrate those things, right?
Yeah. Kind of going back to the DBT perspective of really the wise mind, in between, the emotional mind and the rational mind. Can you sit in that wise mind? And how hard is that?
Yeah. Now, one of the things that happened that certainly off camera, I got this message from Prav that had a couple of papers, and the papers, excuse me, were written about this particular meta theory, and I was looking at this and I was like, wow, this is really brilliant. These papers are great. And I tried to look up the theory online, and it didn't seem to exist. And then I was like, Prav, I can't seem to find this. And he's like, yeah, that's because I made it. This is mine. And I'm really interested in you create this framework to guide the processes of use of psychedelics, and why the whys we're using this, the structure on what we're doing with it. Do you mind introducing a little bit about that?
Yeah,
What
I mean,
yeah.
I think maybe it might be better to sort of understand where that came from
Sure.
in the first place, right? So, like I mentioned, I had an interest in mental health, um, and with that, part of that came actually from my own experience
Uh-huh.
with depression, and this came at a very terrible time. I think I was close to 21 years of age. I had chronic back pain from a car accident when I was 17. And, living with pain day in and day out has a significant toll on your mental health. And, it was interesting actually, because at that time, you know, having grown up in the environment that I had essentially attached my own identity to two aspects of myself. So one was the intellect, right? Because I was always a smart kid, always, top of the class. And the second was like physique, because I was more or less bodybuilding at that time, and, had relatively, you know, good physique. But during the period of chronic pain, when I was in pain for at least 5 years, well, that went to the wayside. I had significant cognitive deficits from the chronic pain, which impacted my ability to study, and I was trying to get into medical school and finding that I was taking 3 times as long to study for certain classes or tests or whatever. And it was significantly stressing. And secondly, having that chronic stress response activated, I was, even though I was working out, I was still gaining weight. I would eat more, stress eat, all those sort of things. And then, just the personality stuff that would happen. I remember being deeply paranoid about people's intentions against me, that they're putting me down, a lot of sensitivity to criticism. And I still reflect on this situation where even, when I was trying to get into medical school, my parents were like, hey, we have friends who have kids that are in medical school. They could help you. Instead of me taking that as, my parents wanting to help me and looking out for me, I took it as criticism of me, right? Yeah. So it was, the distortions were unreal. And as I mentioned, I had, and this is where all those rigid frameworks actually developed. It was my way of getting more control. Because, if it took me 3 times longer to do a test, well, I have to make sure I was up at 3:30 to go study and, spend X amount of hours per day. So that's where that sort of framework came. But, I was slowly getting over it. I had got surgery. I was pain-free, my third, fourth year in university, things were improving. And because I didn't have, a big trauma load from my childhood, I was able to get over these things, in relatively short order. But, that took a lot of reading. I went back to my strength of intellect. So I went back, started reading research articles at that time. I started looking into mental health a little bit more, reading philosophy and other books in psychology. And so really when I started doing all of that, I got a greater richness of understanding, because I've also had that personal experience myself of going through that, at least on a temporary basis. But then, you get into medical school and you start getting your lectures in psychiatry, and you begin to understand that most mental illnesses are based on the ICD or the DSM-5 diagnostic criteria. And although it's great for categorizing individuals into nice little pockets, it does very little to really address the richness of mental illness and where it comes from.
Yeah, absolutely. It's all symptoms.
Yeah. So it was, so this is like 10 years into thinking about these things and reading these books. And then, I continued to go to ayahuasca and gain insights about myself. And during that time, that sort of expanded it to inviting other individuals that were interested in sort of self-exploration. And, I had one of my connections there was a woman in her mid 20s. She had a horrific life. She was born into a family where the father was away for several months at a time because of their job. When he did come back home, he was an alcoholic and very abusive. They also experienced sexual assault that continued for many years by a close family member. They had significant bullying at school, no real good social relationships, felt ostracized by their family, feeling that, they never really were there for them, they never really cared about them, and had gotten to the point where they had a plan to kill themselves, like a methodical way of separating themselves from everybody and ending their life. And at that point, it had, a couple of non-serious attempts, not non-fatal, I should say, attempts of taking their life. And during their experience, so this individual had a very low sense of self-worth. They did not have much love for themselves. They actually didn't even feel that they were lovable or anybody loved them. And so, they decided that, after going through years of therapy, EMDR, trying several psychotropic medications, none of that worked for them. That plan was still in place. And so I sort of spoke to them about this, and, hey, you should maybe consider this, because, they did have that quality of wanting to get better, right? They still had that motivation to want to get better. It felt like it was hopeless because they tried everything. And so they had this experience, and for them, it was obviously still quite profound. They went through some of those motifs that you typically see with psychedelic experiences, particularly ayahuasca. They experienced this sense of ego death, literally visualizing themselves in a casket flowing down a river. They felt a universal sense of wholeness. They even encountered what the shamans call Mother Ayahuasca, this sort of mother archetype figure that helps guide individuals through the therapeutic process. And from there, what was interesting is that for the first time, they actually felt love for themselves and just weep throughout that experience, letting out all that emotional baggage that they have been carrying for decades of their life. The Mother Ayahuasca, basically told them, you're the same as me, and they interpret that as, I'm worthy of love. I am a divine presence. I'm not this destroyed individual that I perceive myself to be. And from that experience, after that point, their perspective on themselves changed quite significantly. Now, it's not like all their behaviors change. They still have to, those are learned patterns that you
still have to work.
It's people think that it's like some sort of magic bullet. It's not. It's, there's still work you have to do. And that's why, that's also where I learned that if people are not willing to do that, this therapy is not going to work for them. Right.
Mm-hmm.
Absolutely. Yeah. Yeah.
And so,
yeah.
So she went through that experience and, started changing perspectives on her life, gained a little bit more self-worth, but still had all this attachment trauma with her parents. Now, her father, at the age of 7, actually at their behest, decided to stop drinking alcohol and became a very religious type of person. But nonetheless, that trauma was still there. They couldn't forgive them. And during their second experience, that's when they sort of understood that, actually, my father and my mother went through a significant amount of trauma in their life. and that the way that they were acting is just the way that they were dealing with their trauma, and actually had nothing to do with me.
Yeah.
And so from that point, they were able to, what I think is, a big hallmark of this is forgive their parents, right? And that forgiveness is nothing to do with them. It's more to do with yourself, to let go of that baggage and just take them for who they are and love them for who they are.
Yeah, for sure. People think that forgiveness somehow means it lets the other person off the hook. It means that whatever happened was unimportant or okay. And that's certainly not what forgiveness is at all. It's about the inner experience in which you continue to drink a little bit of poison every day.
Yeah. So, when I saw that experience, and that's like, over a span of 4 or 5 years, and just the profound transformation of that person, like, left me puzzling. I'm like, what the heck is going on here?
If there's one thing I could point out, because I know that this directly fits into the framework that you're talking about, or that you created, and that is, you mentioned that there's an intergenerational effect. There's these structures that are not just held by me, but actually some of those structures were actually handed to me through an intergenerational process of transmission.
Yeah. So, now sort of getting into the background here of this, the paper I sent you. So I framed it as, or conceptualized it as, the dysregulated, so the way that it came about actually is, I should get into that first, is actually, I was sitting there talking to this person about all the things that have happened. And when they were describing their experience, I sort of got that framework, just the name pop up into my head. And so the dysregulated, externalized matrix of notion is what came to mind. So what that really means is that at its core, there is a lack of an identity for an individual. In fact, their identity has been fragmented due to early childhood and relational experiences. And because this individual is not whole, they have developed a lot of mental constructs to help them deal with the external world, which they may find dangerous. And unfortunately, when they develop these sort of concepts, it's typically in the adolescent years, where they really don't have a good cognitive framework of understanding reality. So a lot of these, as a result, they have a lot of emotional dysregulation when interacting with other individuals that are close to them, or even the world as a whole. And really all this comes down to is the fact that they don't really have a whole sense of themselves. And they have this matrix of notion, or ideas, or precepts of themselves in reality that's not based in reality. It's sort of like a figmentation that has been created for them due to the inability to process what happened in their early life.
Yeah, now one of the things I want to make sure that I understand about this correctly, and that is, you're talking about, of course, the dysregulation is the way in which they relate to the world. The externalization has, to a certain degree, in which they're constantly looking to the outside for an inner sense of self. I've got it right so far, right?
Well, what they're really doing is they're looking on the outside to help regulate their emotional state, right? So we could get into this as I sort of go on with, even I don't know if you saw the other paper as well, the neurobiological underpinnings of this.
Yeah, I read that.
Yeah. So typically, I'll give you the case of even that individual. So, a lot of the work that I've looked at, relates to attachment theory, family systems, and Arabic cognitive behavioral therapy. And, as Bowlby states, there's several types of attachment patterns that infants develop during early childhood. And depending on the type of attachment that you have, you could develop predispositions to reacting to situations, emotionally charged situations in particular ways. So individuals that have a good relationship with their parents, where their parents have always been loving, caring, attentive, have a strong sense of identity and themselves. They feel safe enough to explore the world and be okay with themselves. But other individuals that grow up in households where the parents weren't loving, perhaps the parents were dealing with mental illness themselves or substance use, develop different types of maladaptive attachment. So in individuals where, let's say you have the alcoholic father who, is nice when he's not drinking, but that becomes abusive when he's drunk, can develop an avoidant personality disorder where children get ingrained into their mind that relationships bring with them uncertainty. Sometimes it can be good, sometimes it can be bad. And they develop that framework and apply it to the external reality and develop maladaptive coping mechanisms to help them deal with that.
Right.
And
Back to pause for just a second. Like, they work with where they came from. That is, in the situation that they were in, they survived because of those coping strategies. But in the long run, they become rigid and they don't work.
Yeah. So even in those situations where you have sort of the anxious attachment type, where you have this uncertainty in relationships, you could develop coping mechanisms that at that time could be adaptive. You could be a person that maybe suppresses your own emotions because, if you bring up anything emotionally charged to your father when he's in that state, he might, react poorly to that. Or you may develop people-pleasing skills in order to avoid that harm. And initially that can be helpful because it helps you to navigate that situation, in your childlike mind. But later in life, it can become maladaptive. You could expect others to act that way. So if you're a people pleaser and you're around individuals and you're constantly giving yourself to them, but they don't return that to you, that may you may take that as an attack on your personality, or take that in a negative manner and experience that insecurity of self-doubt or a lack of connection with those individuals.
Yeah, no, Prav, there's one point I really want to make sure that I make in this, and that is everything that you're talking about entirely makes sense. And for the individual that's experiencing it, we got to remember, we got to remind them that this is implicit learning.
Yeah.
This is not something that they have in their awareness. And so we just bumble and stumble through our life, not knowing that we're living with these rules that we built that we don't even know are there.
Yeah. Like I tell a lot of people, the brain is an association machine. So it's built off what it finds, and then it uses that rule until basically it won't work, or until you have that cognitive awareness of, oh, I need to substitute that, but that's really hard to do, to bring in that judge.
Right. In fact, I think this is where it links to that other part of, your theory, that is the matrix of notions. That's really in a portion what we're talking about, right? Is the cognitive schema, the structures, this matrix that they have inside themselves, they don't actually even know is there. They just keep playing it out over and over and over again.
Yeah. I mean, like I said, so these, when you're that young and experiencing such an unstable environment at home, you sort of have to develop these coping mechanisms to survive during that period of time. And these coping mechanisms really get ingrained into your sense of self and how you perceive reality to be. And then again, like as Jeremy was saying, it gets sort of in this subconscious space that you're not even aware of, but it guides all the decisions in your life when it comes to particular experiences with other individuals or how you interact with the world. And it could serve as a strength for a period of time in your life to help you get through things. Then at another point, it becomes maladaptive and it doesn't work. It can lead to frustration. It can lead to anxiety. It can lead to depression, and the development of a mental health disorder. Like that's sort of the way that I view these things. And it's unfortunate because as I mentioned previously, and insight that other individual had is you realize that these ideas that you developed in your mind when you were young were unfortunately passed on to you by your parents that also went through somewhat similar experiences or
Yeah.
something that has distorted their perception of reality and how to operate.
Yeah. One
Yeah.
of the things that I'd really want to emphasize, and that is that you're trying to extend a position of compassion. That is, when you describe this story, the person comes to compassion and realizing, my parents didn't do this to me on purpose.
Yeah.
And that's really powerful. I think for a lot of people and in our world, sometimes it's things such as in my own life, my brother died. He just died out of the blue at 39 days old. My older sister was 18 months old. Well, her parents, her parents, were devastated and were like a shell in a very critical part of her development. No, that's nobody's fault, but it certainly had an impact on her matrix of notions across her entire life.
Yeah. Yeah. Like you start to view reality in a certain way. I mean, and it happens, right? Like, I think the common aspect which you point out there is maybe your parents had an acute adjustment period where they were emotionally distraught, and it occurred during a critical time in terms of development for your sister, and unfortunately that got implanted into her implicit memory. Considering that was almost half of her life at that point, right? And then it just projected into the future. And sometimes we don't even know we have these issues until we start getting problems in our life and have to reflect on that. Sometimes people are able to get to the core, otherwise, other times they're not. And, they stay in that state.
Yeah, I find this really fascinating. Trent, I think I cut you off.
Yeah, because I was almost thinking about going back to that anxious parents will basically, are people that have anxious attachment, for example, will recreate the same environment that they grew up in, and that's really where that comes from. But then, as you said in that one paper, it's also about how then their child then interprets that anxiety, and it can almost like splinter and almost skip a generation where can go from they can almost have, or the child can have the same sort of coping mechanisms that the grandmother had.
Right, because they'll use a rebel process.
Holy,
that was not okay what happened in my life. I'm never going to do it this way, but they don't have a differentiated experience, and they just replicate it from a reverse position.
Absolutely. And it's almost like if we don't learn from history, but it's also understanding our implied history, we're doomed to repeat it. And I'm not saying that that's a negative thing, but it's through utilizing psychedelics, having this understanding that we can finally realize, hey, I don't need to replay the same action movie over and over again. I can make the new narrative.
In fact, Prav, I've got a question for you. That is, if you could explain to us on a biological level, neuroscience, however you want to say that, the way in which the psychedelics fit in terms of allowing the flexibility to see things and think things differently. You've described the experiences that people have. Can you connect the kind of the biology and stuff to this?
Yeah, it's actually it's so fascinating. So there's a couple of aspects to this. So psychedelics are pretty unique. They're your classic psychedelics, your LSD, psilocybin. They bind to serotonin receptor 5-HT2R8, and the binding up to that receptor releases brain-derived neurotrophic factor. So it's a neuropeptide that facilitates synaptogenesis. So increasing connections between parts of the brain, right? And so these neuroplastic changes occur very quickly, right? Soon, within the first week of taking the psychedelics. And so that's what's happening on the biological, neurobiological level. And in terms of like the brain connectivity level, it suppresses what we call this default mode network. So this is the parts of the brain that are active when you're just thinking about yourself. It actually inhibits them. And by inhibiting those various brain regions that form the default mode network, individuals are experientially able to dissolve the boundaries of themselves. So there is no self-referential thinking. You actually expand beyond yourself. And this is, a very common experience with the psychedelics. It's one of the classic experiences that individuals can have. And what this facilitates is this sense of interconnectedness, that you're actually outside yourself and a part of everything else. And so, when you do that, when you get into that mindset, something unique happens. So in trauma experiences, people commonly go back to the point of trauma and can view it like a movie. They see it frame by frame of what's happening. But because they are removed from outside the situation, they're almost viewing it from like a third person perspective without the emotional valence that's charged. And when they are able to do that, they're able to process that trauma in a more healthy fashion. And, that's a part of that healing process that happens. And in terms of, what I described earlier, I was able to see my rigidity, to see where I was rigid as a person, and then able to transform that rigidity into, being more flexible, being more open. And that's really what, is at the core of how psychedelics work. And it aligns with the neurobiology as well, which is actually quite interesting.
Yeah. Yeah. So as you bring that up, it really makes me think about my developmental psychology in the sense that for a lot of people there's forget how many levels of developmental psychology there are. I think there's 5, and the average person only gets to about the 3rd level. So really what it is that from that perspective, it almost takes you back to level 1, and then you're able to build up even further because you don't have that maladaptive 2nd or 3rd layer from your family, and then you're able to really observe that.
Yeah, like a building that the foundation is actually flawed and cracked. Mm-hmm. It like gives the opportunity to pull out the foundation and to rebuild the new one.
Yeah, absolutely. Why? And you're not throwing out the baby with bathwater. It's like literally picking up the house, taking out the foundation, and putting that back on, and then we can fix all the other structures.
Mm-hmm.
Well, and if you sit there and you reflect on this is really cycle breaking, right? You're breaking that cycle of trauma.
Yeah, totally.
Right, and I sometimes reflect on that, like, is our current state of society due to the fact that people have long chains of intergenerational trauma that transform and morph over time. Mm-hmm. And, this could potentially be a form of therapy where we can break those chains.
Uh-huh. Yeah, like if you think about this, certainly as social workers, we function within the notions of systems. And if you think about the colonizers that came to the Americas, they were highly oppressed. And one of the messages that kind of they got in this process was, you can be a landowner, you can be like us, you can be one of the people in power. But those traumatized people came across into the Americas and traumatized a whole bunch more people.
Yeah, they brought their trauma with them.
Mm-hmm.
Yeah, and of course, and then too, you have to ask yourself, with the First Nations people, then how was that transmitted to them?
Yeah, and I'm sure that they weren't a perfect society either. I'm sure that they had their own troubles.
I mean, we don't even have to, think of that on a conceptual level. The data's there, right? Like, so if we start looking at like ACEs, adverse childhood experiences, right? These get accumulated, especially in when there's significant intergenerational trauma. Trauma just keeps getting passed on. So if you look at individuals that had at least 4 adverse childhood experiences, they're 4.5 times more likely to develop depression.
Uh-huh.
They're 3 times more likely to develop a smoking addiction, 5 times more likely to develop an alcohol use disorder. They're like 6 times more likely to commit suicide, 12 times more likely to have suicidal ideation, and the list goes on. And it's
Yeah.
just not, it's not just
Totally.
psychological issues. They
Yeah.
have difficulties in interpersonal relations. They have difficulty, or they have a higher burden of physical illness as well.
Conditions for sure. Absolutely.
Yeah. Because of course,
Yeah.
it's going to represent somatically.
Yeah. Like irritable bowel syndrome,
Yeah.
autoimmune disorders.
So, I mean, if you think about it, if you could break those transmission cycles, yeah, maybe that person's diabetes is not going to go away, after 40 years of a dysregulated HPA axis. But because he broke the cycles, maybe now their children won't be as susceptible to developing illness or mental
Exactly.
illness.
Totally makes sense. Now, there's one aspect that you touched on earlier, but I want to double down into a little bit at this point in time, because the many times as we've spoken before, you've talked about the really important aspect of spirituality. Now, one of the things that that in the papers that you sent was that was one of the, I think, most particular, important, and maybe difficult links to make when it comes to being a Western practitioner that comes from a place of Western science. And I'm very interested in knowing the links that you've kind of developed and how you see this.
Yeah, I mean, there is a strong spiritual component to psychedelics. There's like no denying of it. Anybody that has gone through one of these experiences have, had that profound sense of unity, these paradoxical thoughts of being nothing and everything at the same time. And in fact, it's so common, they've developed a metric for it. It's called the Mystical Experience Questionnaire. It's developed sometime in 2006, but the work was ongoing since the 1960s. And actually, what the research finds is the higher the score on the Mystical Experience Questionnaire, the greater in reduction of various mental illnesses and the longevity of that reduction. Right? So, yeah. So, there's some things going on in the field which I find kind of funny, and tells me that individuals probably haven't had the experience for themselves. Is this concept now that's developing about maybe we can make psychedelics drugs without the psychedelic experience. That is just a receptor that we're activating, and that could be enough. Which I don't think that's the case. So there is a strong spiritual component to this, and even the quantitative data shows that the more true of experience of we have this, what they call the mystical state, the more likely we are to improve mental health and the longevity of it. So there is a strong spiritual component of it, but psychiatry and Western science does not want anything to do with that, and you have to reconcile those two things because they're both at play here.
I don't know if you would be able to answer this, but like with people that, like you mentioned at the top of the podcast, that kind of just look at the medicine to fix them, or in I would say almost bypass, where they where is there a link between bypassing or looking for the medicine to fix them and a lower level on that mystical scale?
No, actually, I haven't looked at that. I don't even think there's literature out there that has looked at that. But anecdotally, people that don't see improvements in their life, they may still have that experience. I think it's quite common with the psychedelics, but whether so I'll frame it this way. Actually, this is a better way of understanding it. So what I tell people is psychedelics opens the door. You can see what's on the other side. You can see what life can be like, but you still have to walk through that door. You still have to put in that work. So people can have that experience, but not the transformation that goes along with the experience because they haven't put it into action. And, that may just be the fact that most, a lot of this stuff is happening underground and there's not proper integration. That could be one aspect of it. The other aspect is, I'm sure you've seen in your own therapy where people are just not willing to take the action, and it's hard to motivate them to do it because it's
Yeah.
something that has to be intrinsic that you want to do. And that's why I mentioned even in the beginning, the other individual, although they were going to end their life, they still had the desire to get better, want to do something about it.
Yeah, totally. Even if it's just a seed, even if we can just you plant the seed and it has a process, it needs something to be able to grow in, for sure. Prav, this brings up another thing that we've talked about off camera before, you and I, and that is this westernization of the use of psychedelics and concerns that you've had about them divorcing it from its origins, divorcing it from ceremony. I'm really interested in what your thoughts about that for our listeners.
Yeah, I think there's a certain level. Well, on one level, there's a certain level of respect you got to give these agents, right? It is, some can even say it is a sacrament that you're ingesting and that is allowing you to have this experience. But it's sort of the debate I have in my mind, or the way that I see things is, there's this a huge underground scene of people administering psychedelics, and they're more on the spiritual bend of things. And then we have our Western sides, and granted, it needs to be legitimized in the framework of Western science before it can be used as medicine. That's just what it is. But focusing too much on this drug disease model, you really miss the therapeutic benefit of these agents, or the potential therapeutic capacity of these agents, right? So if you have that, two of those worlds combined together, which I think could fit actually quite well. I don't think they're two completely separate things. I think, especially in the field of psychiatry, you're on that boundary with spirituality, so it's right there. So, I'm just watching the space for right now to see how people proceed, because obviously psychedelics are not approved by Health Canada or the FDA right now, but it's coming,
Right, except for ketamine.
Yes.
Ketamine, yeah.
Yeah. Right. So that's a really important part of this process too, isn't it? Is there is so much the population, the popular thought around psychedelics has just dramatically changed. People understand more the war on drugs effect on people's kind of ideas around these medicines. I think people are understanding that the dogma over the years about and rhetoric about these is not correct. But we don't want to jump into this, like you say, willy-nilly. Like people could be very damaged, just like any other intervention out there. Just because there's a therapeutic use doesn't mean people should just go use it willy-nilly.
Absolutely. There's a huge difference between using it recreationally and using it therapeutically.
Yeah, it's the structure. It is the controls that are in place. It's the people that understand the medicine, the setting that they create.
Yeah, and that plays a part now, a role as well, right? I viewed a few facilities that are sort of prepping themselves to administer psilocybin-assisted psychotherapy. And, the setup is pretty similar to the clinical trials. You have a nice little bed or comfortable space, but it's in a building in the middle of downtown, right? Like when people, so these ayahuasca ceremonies, they're out in nature, and they say it's important to be out in nature, to be disconnected from everything else, because that the set and setting plays a huge role in terms of the therapeutic outcome. It actually plays a huge role in terms of even being able to have that mystical experience as well, right? It could help to improve the odds of it or the degree of it. So, there is a component where, now if you view that from the Western science point of view, like, what do you mean? Why do you need a ritual? Why do you need to have a specific setting for these things? That has nothing to do with the biochemistry of the agents that you're using, right? So
but it does have to do with the psychology.
Oh yeah, very much so. Right?
The psychological experience of what they're engaging in, for sure.
Yeah.
It's funny that there's still resistance to this because we've known for a very long time that the effect of a drug, if you were to use, for example, even marijuana, cocaine, heroin, is vastly influenced by the emotion and psychological state that the person is in, the physical environment that they're around, actually makes a big difference in how it biologically affects them.
Oh yeah, absolutely. Like even with drug users, like if they normally inject in a certain area, their body will prepare them when they're in that area to take on that drug. And if they do it somewhere else, they could use the same amount and it could kill them because their body is not prepared.
Yeah. So it's fascinating. Sorry, I didn't mean to interrupt you. Go ahead, Prof.
Yeah. So, so that's sort of the conflict that I'm seeing right now in sort of how the space is evolving. But I think what that will ultimately end up in is a lot of variability, I think, in terms of how the clinics may be set up in the future. But,
Right.
There's lots of variables at play that we still don't understand, right? So even, for example, the music that's used, right? So I don't know if people aren't familiar, the basic setup for these therapies is you go into a room, you'll have two individuals there with you, typically it's a male and female dyad, and you're laying down on a comfortable couch as you imbibe the medicine. You got shades on and you got headphones on that play music. And, for the most part, it seems like it's sort of not very methodical in the way that the music is chosen. I don't think people have given it much thought. If during ayahuasca ceremonies, there's also an element of sound that's used during that ceremony. And it's actually the poems or the icaros that the shaman is vocalizing. And, as I mentioned, I initially went with that sort of scientific mindset of how these things work. And because I had that sort of framework, I was able to pick up on some things which I thought were pretty fascinating and other people experience as well. The chanting, the frequency, the pitch, the volume can influence your emotional state, which determines what memories or images come up in your mind during that experience. So the music can actually serve as a guide to facilitate certain emotional experiences or bring back certain memories, which I don't think has thoroughly been investigated at all. In clinical trials. Again, it's still on the disease drug model.
Yeah, totally.
Yeah, absolutely. And, I really appreciate that you are really articulating the fact that, that we have to respect what's there and understand it through the Western lens, because you can't, we have, even though we want to try and bring all this in, you have to use the language of both in order to make it as effective as possible.
Yeah. Now, I do have actually another thing that I'm curious about here, because of course you work within the medical system of the Canadian Armed Forces. While I believe that this conversation that we're having is important across our society and for many people, I'm also fascinated within the niche area that you're in. How do you see this playing out when you're a psychiatrist with the Canadian Armed Forces? How do you see this being implemented within that medical system?
Well, I mean, the Canadian Armed Forces is actually quite a progressive organization, especially when it comes to healthcare. Personally, I believe, it's an exceptional healthcare system, and our patients get some of the best service out there, definitely compared to individuals in the provinces. Hands down, there's no question about it. Right now, as evidence comes out, they'll approve therapies as they see fit. I don't see any reason why they would not approve psychedelics. They've already approved ketamine on a limited basis, but just we aren't there in terms of the required trials and FDA approval and Health Canada approval. Now, when that happens, and eventually when this becomes an authorized form of therapy within the Canadian Armed Forces, right now, likely what will end up happening is they'll outsource to other clinics that are doing this particular type of therapy. Initially, that's usually how it's like, but it's very costly. It's not cheap therapy, and trying to develop more of an internal program, I think would be quite helpful, right? And it'll be quite cost effective, and you have more positive control. I'm going to be trying to work towards that. I want that to happen. And as I mentioned, we provide some of the best healthcare to our members, and this will just be another tool that we could potentially use. And particularly in the military context, it's it can be used very effectively. If you look at some surveys, the number of ACEs amongst military personnel that have 4 or more ACEs is like 30% in some studies, compared to the population average of like 12%. So there is a lot of traumatic burden that's on military members, and obviously they go through a lot of trauma serving in the military. And these psychedelics can be used effectively to help treat their mental illnesses. So that's my goal. I want to try to go down that path and create something that's of my own machination and understanding, and try to make sure that we can deliver for our members.
Wow. I do a little bit of work with psychedelic integration. I'd really be interested to see what your eventual program looks like. Because like you said, every program is different. And the level of understanding that you have about setting, bringing in the chanting, I would really be interested to see what that would look like and how that would impact outcomes and how that would change my work as an integration therapist with people.
Yeah. One of the things I noticed, and maybe I'm reading too much into this, but you talked about traditional psychedelics. So that would be like psilocybin, LSD, ayahuasca. Ketamine is not on that list, is it?
No. Oh, I mean, the ketamine doesn't work on the same receptor. Same thing with MDMA. MDMA is not a classic psychedelic. MDMA is a stimulant. It's an amphetamine, right? It can have similar effects to psychedelics, but not the same effects. It's more of the affective changes with MDMA, allowing individuals to access traumatic experiences without that negative emotional valence. But the classic psychedelics are really the mind manifesting agents. They're the ones that allow you to restructure cognitive frameworks, maladaptive cognitive frameworks. And so, I'm going based off of that. That's the mechanism, right? So like that's what it does.
Yeah.
With ketamine, it's not like that. I mean, it's not my preferred. I wouldn't prefer it because of that. Because
I've read that.
Still. Ketamine still requires like multiple treatments and who knows how much maintenance and all that. Whereas, if you have the classic psychedelics, you only need 2-3 times to use it to have those profound. Like I said, within the first week, you'll notice a huge drop in depression scores or anxiety scores. It's almost immediate.
So, in fact, I think this is probably a really good place for us to start to pull things together. I'm very curious. I'd like Prav, maybe if you would like to start, or it could be one of us if you want a moment to think. But we always end our podcast with a bit of reflection about what it is that really stands out to us in the conversation. Would you like a moment, or would you like to go first?
Well, I mean, I think it's a point of agreement that we had in the beginning there, right? Like right now we're stuck in this disease drug model that psychedelics are being used to just treat mental illness, but they could be used for far more than just treating mental illness.
Yeah. And and I really appreciate that you ended with mental illness, because I really think that like with psychedelics, that yes, it is coming in vogue, but this is an evolving field that people are just starting to take the first steps. That, like you said, that there are more things to do, and that what I like from talking to you is that it's about how can we begin to integrate more of that traditional knowledge and really help people before they get to that disease point, so that maybe you have somebody that, like you said, with that one individual that has that spark, that can we build on that so that it's one session and that you're stopping the trauma before it gets transmitted to their children, to their grandchildren. Let's cut it off at the root so that the tree can grow healthy again.
Yeah, for me, I see two main themes for how this is used. One of them is for the more overt trauma, as you described in that recovery. And the other is for that intergenerational transmission of subtle things that people have, that implicit internal experience, the matrix of notion that they could potentially have more flexibility, they could see the world in a different way, and they could move towards wellness. Absolutely.
Yeah. This was a truly transformative conversation.
Yes, thank you for joining us.
Yeah.
You're amazing. I appreciate you in my life.
Mm-hmm. Mm-hmm. Yeah. And on that note, I'm Trent Akers.
And I'm Jeremy Alcorn.
See you next time.
Thank you for joining us today. We hope that this message has been as meaningful to you as it has been to us. If you're looking for help, you can find us on Facebook at Humanizing Mental Health.